Hello, welcome to our YouTube channel. This is Pueblo and Foot Care. I'm here with Dr. Kite. I'd like to urge you before we start having our conversation here to subscribe and hit the like button. Welcome. So we have our new podiatrist, Dr. Kite. He's been with us for just a short time, and we're excited to have him. I wanted to ask him some questions, and certainly in the future you might also have some questions for him. Feel free to drop those to us and to our team. We'd love to do that with you. So welcome to Pueblo and Foot Care, Dr. Kite.
Thank you. Happy to be here.
Yeah. So I understand that you have a very compatible practice philosophy with Pueblo and Foot Care. Tell us about that.
Well, I go through, I have a long history of having extensive training in things like surgery, but surgery isn't something that you want to jump to as the first sort of tool in your toolbox. Exhausting all the conservative measures, making sure that everything has been done where if it comes from injection therapy, if it comes from doing laser therapy, if it comes from doing other modalities like ultrasound, shockwave therapy, those are all things in our toolbox that we can try before needing to go underneath the knife.
Wow, shockwave, that sounds kind of worrisome. What's shockwave therapy?
Shockwave is just using ultrasound and basically sound wave therapy in order to provide a sort of a rehabilitation to some of the aching pains and muscles and inflammation we have in our bodies.
Okay, so I understand too, as you were going through your training, you had a pretty comprehensive residency program and also even did a fellowship afterwards. Tell us about that.
Yes, I did a fellowship in Brooklyn, New York. In a wound care center, mostly associated with a hospital and a residency program, where I got to see a bunch of different pathologies that are there in New York. You see lots of different types of wounds, lots of different types of biomechanical problems that people need fixing, and I got to do different types of wound grafts and treatments that really help the population there.
Wound grafts, that's kind of cool. So you think that you want to put wound grafts on everything, wouldn't you? That would speed up everything, wouldn't it?
Not for everybody. Some people have the ability to heal, they just need that extra push. The wound graft really helps with that, and in that way I can help my patients the best way.
Yeah, absolutely. Well, thank you so much for sharing that with us, that wound care philosophy and your patient care philosophy. We're going to be coming back to Dr. Kite as well and asking him some more questions. Stay tuned.